Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to another episode of Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself for better health with the #1 podcast for patient advocacy, affirmation, and education. This week, we bring you Dr. Kat Ogle, who is a board-certified emergency medicine physician currently practicing at George Washington University. Most importantly, she started out as a registered nurse before becoming a physician, which, for those who have known me, I always talked about the story how when I was an intern, the first time I learned how to treat this really significant critical care illness in the ICU was from a nurse. So I've always had a love and respect for our nursing community because I know how hard they work. So definitely love having that background. And she talks about that a lot on the podcast this week. And we're going to be talking to her not only because she is an amazing emergency medicine physician, she is extremely active in medical education, where not only she teaches residents, but she also teaches fellows as well as medical students. But most importantly, she is also an author. So she's added that to her list of amazing things that she's already doing. And we're going to be talking about her contribution to the most recent anthology, the Chronicles of Women in White Coats, Volume 2. And we're going to be talking about her motivation and, what got her to the point where she said, I need to put pen down to paper. So this is going to be another amazing episode. So please stay tuned for a lot of amazing insight that you do not want to miss. Remember, subscribe to the podcast, tell 10 of your friends, and take notes. You guys have a blessed day. This podcast is sponsored by the Lunch and Learn Community Merchandise Store, living out the motto, empower yourself for better health. At the store, you can get your favorite t-shirts, coffee mugs, even wristbands, and more. For a limited time, you can get 10% off your next purchase using the coupon code EMPOWER10. That's EMPOWER10, EMPOWER10. Just go to shop.drbarrypr.com to pick up your purchase and get 10% off today. And remember, 50% of your purchases will be donated to the 5-Star Scholarship Foundation, a nonprofit organization for high school students. All right, Lunch and Learn community, you just heard another amazing introduction from a guest who I am very interested in talking to. One, because she is an accomplished author. Two, because just looking at her bio, she's into graduate medical education. And really, more importantly, we're going to talk about her work as an ally in the White Coats for Black Lives movement. Dr. Ogle, thank you for coming on to Lunch and Learn community and blessing us with your presence and really just kind of getting us together. I appreciate it.
Thank you so much for having me. I really appreciate it.
So what I like to do, especially in the beginning, because I typically have a lot of my listeners who, even though I do a good introduction, I think it's a good introduction, they always kind of fast forward and go to the main part of, I think they just like to skip my commercial. I have a little commercial. I think they like to skip the commercial aspect of it. And they go right to this main episode. So for those who may have skipped it, right, say, who's Dr. Ogle? Like, can you give them a little bit of a, like, hey, if you skip this, this is who I am. This is why you should listen to me. This is why I'm so amazing.
Absolutely. So I am Dr. Kat Ogle. I am a board-certified emergency physician, and I'm actually the first person to go to college in my family. So I actually was a nurse for 7 years before I became a physician because I wanted to try it out and make sure it was really what I wanted to do before investing the time and the money, because I was responsible for paying for my college education. And so those foundational years as a nurse were really informative and really helpful for me in maturing, as a young adult and really preparing me to be a physician. In my practice, I am in an academic emergency department, and I work in 3 different hospitals. One of them is the community hospital or the city hospital. So it's lower resources and folks who are really beholden to social determinants of health. And the other is the Veterans Administration Hospital, and then our tertiary academic center. So I have 3 very different clinical sites where I see patients. And then I am also, as an academician, I teach at the medical school with medical students, residents, fellows, and I do some faculty development as well. My passions, I would say, are primarily medical education and point of care ultrasound. And more recently, I have really developed a passion for diversity and inclusion, and really transitioning that over into what it means for me to be an ally to persons of color.
And what I love is, and I tell people all the time, every physician's path is different to get to where you're at. Typically, the patients and really just the general community typically see the end result, and for some reason they think we golf a lot. I've never actually golfed a day in my life, but they think we golf a lot. They just kind of seem like we have
love
like
the
these
driving
similar,
range.
right? Like I've never like, and they trust me. They keep inviting me, and I'm like, yeah. I can't do it. Like, if someone one day, someone's just gonna have to like drag me, and then I'm pretty sure it'd be surprised. I'd probably love it, like if I actually got there. But I think the closest I got was they did a simulation, and it seemed interesting, but I was so bad at it that I stopped doing it. I'm like, oh, I'm terrible at this. I'm not gonna keep embarrassing myself in front of all of my colleagues out here. So it's interesting when I see, especially those who come from the nursing field, right, who come into medicine, right? Especially because I figure if you're that close to our field, you're like, ooh, like it's kind of rough over there. Like sometimes I almost feel like that could be a deterrent, but for you, it seems like you saw, where you were at, you saw where you could be kind of in the future. And you're like, oh, you know what, I still want to go there. And I love that story because I talk to a lot of pre-meds who, they're always weary and concerned about, whether, they can do this as a second career or they can do this as like something else before medicine. They always feel like it has to be this rush job where they have to go right from middle school to high school to undergrad to medical school. And I'm like, it doesn't work. I can promise you it does not work like that. That's not the ideal situation. And even interesting, even serving as during some of the medical school interviews, sometimes we look at that like, oh, like I wonder if this person is going to be kind of able to handle a transition because they've never had a break per se. So I definitely love, just hearing that path, saying, yeah, you know what, I worked as a registered nurse. I was, and you did a lot of critical care, right? You were like, from what I read, like, so you were not only a registered nurse, you were one of our, in the trenches for real. And I tell people this all the time. When I was an intern, which is first year residency, my registered nurse, who was ICU nurse at the time, she was the first person to teach me like how to treat DKA. Like she was like, no, you need to do this and you got to follow the serial B. Like she was the one who educated me. So I love nursing in general because I'm as a hospitalist, like you almost have to, like, how can you not love nurses in general, but like you have to, because you realize how much you have to lean on their level of experience when it comes to patient care. Because honestly, they're going to see the patient more than me. I just gotta be honest. I'm in there and out of there, but they're going to spend that time. So I love leaning on nurses. So I love our physicians who have that background in nursing, because I think it definitely gives them that other picture, to be able to kind of look at medicine as a whole. So talk to me about, and again, like I said, I'm very interested, right? Because obviously you're pretty involved in the graduate medical education as well. And of course, as a program director, my eyes kind of like get big, right? Because I love to see those in academic medicine. Because as not too many of us in the medicine field really choose to focus on academic medicine. So what was it, about your training that kind of led you in even in that direction when you said, you know what, academic medicine may be for me? What was it that you liked about it?
So it probably started with my roots in nursing, because I was always in a position to be a peer educator, because I was first a charge nurse. And then when I got into the ICU, I helped to develop our curriculum for our onboarding of new nurses. And I was always very interested about how people learn and how to teach things to people. And I also feel like by mastering something and being able to teach it to somebody else, then that means that you really have a solid understanding of it. And there's nothing probably more exciting to me as an educator than seeing the light bulb go on for somebody, because when they get it, there's just so much pride, so much intrinsic pride for you, but also you just feel the pride beaming from them when they finally understand a concept, or they're finally able to explain something, or they're finally able to solve a puzzle. It's just a beautiful thing. And, I also think the thing that drew me to academic medicine was the fact that all of these students coming in, these young doctors coming in, they are sharp and they keep me on my toes. They ask really difficult questions. They ask really challenging questions. And it is inspiring and intimidating. And I feel like it just keeps me yearning for more information, because as physicians, we go into this knowing that we're going to be lifelong learners. We're going to spend our lives learning the medicine, learning the most updated treatment methodologies, and learning the new medications and learning the new treatment regimens, but also just they totally keep us on our toes. And I think that energy really was something that fed me. And I think when I look at my friends who have gone into emergency medicine in the community, and I look at the number of hours that they work clinically, and I think about sort of how I balance my love for medicine and my love for emergency medicine, I do love being in the ER. I love taking care of patients in the ER. I love taking care of emergencies. I love that, rush that you get when somebody comes in with a really sick, laceration, or, a stroke or heart attack, and, trauma, and you're just on it, and you get your team together and you go through A to Z. That's a rush. But I know myself, and I think part of this comes from having a little bit of experience prior to being here. That wasn't all I wanted to do. I also wanted to be able to give back in a way. And I think that's one of the things that just makes academics such a beautiful thing.
What I love is you hit literally all of the points of why I love it as well too, right on the head. Especially because in you're not even exaggerating. The students, the residents. I don't work with fellows, but I can only imagine they keep you on your toes. Like, and they don't even allow you, right, to slack. Like, you may one day you're like, yeah, I just want to slack. I want to kind of chill and relax a little bit, and then they hit you with a question, and you're like, all right, let me go. Let me get back on it. Like, I can't, because you can't even rest. And it is such an enriching experience, because you learn, you see them, you watch them grow. You see them as scared medical students, scared interns, right? And then you see them leave as confident, senior residents, soon to be attending. So it's definitely such a transformation that you're able to kind of witness month by month, year by year. That really, you really can't, it's really difficult to kind of replicate. So I definitely love, that aspect as well too, especially when it comes to graduate medical education, and, just kind of dealing with, those who really keep us on our toes, and really the future of our profession. Now, I will say this, especially with everything going on, how are you able to have free time, right, to even say, you know what, like, I want to write this book, right? So I want to talk about just kind of the motivation behind, the Women in White Coat series too, which you're a co-author in, and what was the origin story behind that, and how did you find time to, especially with everything that you do, and Lunch Learning Community. This is a busy person right here. This is a busy person. I train at Wellington. I'm a program director at Wellington Regional Medical Center, and GW, George Washington, is kind of one of for our company standpoint, is like one of our sister hospitals per se. And I already know how crazy busy it is over there. So I can only imagine, and she's at 2 other different hospitals. So I can only imagine just how busy and time consuming that may be. So I do ask, like, how did you end up where you say, you know what, I'm going to write something, right? I want to be an author. Like, how did that come about?
So there's a couple of things that inspired me to do it. And one of the most important roles that I neglected to mention when you asked me to do my self intro is I'm also a mom, and I'm a single mom. I have an excellent co-parenting relationship with my son's father, and we co-parent very well together. But since March, he's been out of school, so that has made things very interesting and dynamic. But to your question about how did I make the time, how did I fit it in, and why was I inspired to do it? What I have realized being an academician is how many eyes are on you, how many people are looking at you and seeing the way you model your practice and your interactions with people. And the number of meetings that I've had with students who felt like their lives were falling apart because they were having life. You know, someone got cancer, someone was having a heart attack, someone had a stroke and they had to figure out, you know, how to take care of them. Someone's family member lost their primary caretaker. So then someone has to manage medical school and taking care of their parent. They would come into my office and they would talk to me as if I was untouchable, as if it was just so easy and I just made it look easy, and that I must not have ever struggled, and how do I keep it all together? And I realized, you know, after having some frank discussions with some of my students about where I've been, where I came from, and what I've been through, the amount of stress relief that melted away from their face by knowing that, in fact, it wasn't easy. In fact, the route was 85 ways wrong before it went one way right, that it had multitude of barriers and challenges and speed bumps and detours. Like, this ain't easy.
Mm-hmm. Oof.
You know?
Talk to him. Talk to him.
I felt like by not sharing my path, by not sharing some of my own personal struggles, I was being a little bit disingenuous. And I thought that it would be really helpful for them to feel connected because of, you know, common experiences and shared experiences.
Now, I've asked this before. I've asked this to several guests before, especially physicians. As you know, you're going along the path of becoming a physician. Were you in close relationship with, you know, obviously as a nurse, you might have been in close relationship with other physicians, but in terms of them kind of letting you know, like, hey, it's tough as well. Because I remember my experience, you know, not necessarily with a lot of physicians, is I used to just think like, oh, like I must be the only person kind of going through these kind of trials and tribulations across this path. And I definitely remember when I first heard, you know, one of my mentors like kind of say like, oh yeah, no, I had to do this, I had to do that. And then I just remember seeing like, wow, okay. Oh, okay. So you can be tough and you can go through these issues and these hurdles and these obstacles and still make it to the other side. Because now I had at least an example that I can kind of attach to a person who I've seen done it. Because a lot of times, you know, we don't feel something can be done until it's done before us. And when you see someone say like, oh yeah, the road was tough, like, and tough is being light. The road was tough and I still got to where I'm going, is definitely eye-opening. Did you have that experience, like as you were going through, you know, the ups and the downs, like knowing people like who kind of went through that similar, you know, pathway before you?
I didn't really have anyone to share that experience with until I got to medical school. Because, you know, again, being the first person in my family to go to college, my family didn't, you know, they haven't had the experience of needing to do pre-med and work full time. And when I was doing, because my nursing degree was an associate degree, so it was just a 2-year degree to become an RN. And so when I realized that I needed to go to medical school, and I had to start from scratch essentially. And so I was working full time, nights, weekends in the ICU, and then going to school Monday through Friday for 4 years. And during that time,
Oof.
all of
Oh,
my
man.
classmates, It was good training for medical school. I have to say that. It was really good training for medical school. It was like the ultimate marathon training for academics. But most of my classmates who were also pre-med were that typical high school, college, medical school bound, and had the support of their families and had like doctors in their families and things like that. And I was sort of going in blind. I was just like, oh, I'm going to be a doctor. Right. And once I hit medical school, my cadre of friends, many of us were non-traditional students. So we had other experiences and careers. So it's natural that we gravitated together. But when we were really struggling, we were struggling as a pack, and so that was helpful. But up until medical school, I didn't really have an inclination for the challenges that I would meet. And I think the other thing is that as a nurse, granted, I did not work in an academic hospital. It was a private hospital, but I did not meet any supporting words from any of the physicians that worked there, except for one. And she was a Black woman who was an anesthesiologist, and she's a total badass. She's the only one that encouraged me. All the other docs were like, you're just a nurse. Why do you want to be a doctor? They're not going to want you. They're not going to want you. I was like, oh, great. All of my friends, now to sort of the other side of it, all of my friends who worked in the ICU with me, they were fabulous, and they supported me along the way, and all of my outside of nursing friends in Vegas were also phenomenal and supporting me along the way. But I didn't have any doctorly mentorship until I got into medical school.
Do you feel, I'm not saying subconsciously, do you feel like that, just that having that lack of mentorship, especially at a time where it would have been great to kind of have some, do you feel that also kind of helps drive, your will, to be in someone else's life, whether it be peripherally or even directly, and kind of helping them along?
Absolutely. Without a doubt. I mean, there are a couple of medical student groups that I follow on Twitter, and I've offered to be mentors for them. And it's like First Gen Med and Black Girl White Coat, and a couple others, because I want for them to have that. I want for them to have a little bit of support and a little bit of guidance and someone to bounce ideas off of.
And I think what's so important, especially when we talk about, having that level of support and having, that guidance, almost like that shining light, especially in a time when darkness is there, right? Like, obviously, depending on Lunch Learning Community, depending on when you listen to this, hopefully you listen to this like the week it comes out, but let's say you're not, right? If you turn on the TV, a lot of issues are going on, right? Especially when it comes to Black Lives Matter and the murder of George Floyd, and just the murder of Breonna Taylor, and just, all these things that just keep happening over and over and over again. And I talk about it, especially as a physician, because I know there's issues in the legal system that clearly need to be corrected. But I also know in the healthcare system, we're kind of in a glass house as well when it comes to a lot of the racism and, the prejudice that kind of goes along with our system of care. So we have this faction, White Coats for Black Lives Movement, and which is really kind of this sounding board to say, like, hey, we as doctors recognize, the importance of the Black Lives Movement. And can you talk about kind of your experience, with that, right? And I remember, for those who know, I'm at Wellington. We actually did a kneel in, I guess, but it was kind of outside a hospital. It was me and about like 7 to 10 of our residents out there. And again, it was kind of a lonely experience, right? Because it's difficult to get everyone involved, right? By everyone, you want, like, administrators and everything, but sometimes you kind of have to go it alone. What has been your experience with just kind of, being an ally and just the white coats for Black Lives Movement in general?
Mm-hmm. So I have to say that this is the first time in my life that I have actually begun to recognize my privilege as a white person. I think I also was always the person who was like, well, I have black friends and I'm not a racist. And, I support my friends and, I hang out with them and I hang out with their kids. And what I didn't what I didn't realize until really in the last 2 months or so is I didn't see them. I didn't see my friends. I didn't see what they were feeling when they watched these horrific things happen on the news. Like I could just I could just ignore it because that's my privilege. And that's what I've done for most of my life. But what I have come to realize now, and part of it also has to do with conversations that I've had with one of my sheroes, Dean Yolanda Haywood. She has been sort of a pillar of strength and guidance for me through my career at GW. And I've sat down with her, and she's currently the dean for diversity and inclusion, and she's also been dean for faculty affairs and student affairs. She's told me, well, Kat, jokingly, obviously, there's no contractual obligation here, but she's joked around with me that I could have her job when she left. And I said, well, but I'm white. I can't be responsible for diversity and inclusion. I'm white. And she's like, it's not just about racial diversity. Now, that is what we're talking about right now. And I think the conversations that I've had with her over the years have sort of scratched the surface, but it wasn't really until I started talking to my friends, like actually talking to my friends about what they were feeling and what they were seeing. I think one of the things that really kind of hit me right in the gut was a friend of mine shared an article that was about, when does my beautiful Black boy become a threat? She's got a 7-year-old.
I think I remember seeing that. Yeah.
She's got a 7-year-old and I've got an 8-year-old. And it just slapped me in the face that I'm not going to need to have that conversation with my son. And I started to become horrified about this. And then I started to realize, like, as parents, there are innumerable things that we feel guilty about, that we feel stressed out about. That is not one of the things that I have to worry about. So this was like a way that I could connect with my friends who are physicians and listen to them, just to start to open my own ears and hear their experiences. And when I started to do that, you can't stop, And so you start like reading things. And so, I'm reading Ibram Kendi's How to Be an Anti-Racist right now, and I've got stamped on my, next list, and then White Fragility. And so what it created this hunger in me, sort of like the lifelong learner. There are other things that I need to learn, that I need to be a part of, to make the world better and to make medical education better. Again, sort of taking it back to being an educator and being an academician. I need my students to know that I'm a safe place to come to if they see racial inequity, if they see racial discrimination. But I need to show them, and I can't just say it. I need to show them that I am here. I need to demonstrate with my actions. I need to demonstrate with my words. I need to truly incorporate into my own curriculum for the courses that I teach. Like, okay, what parts of this have potentially been, demonstrative of institutional racism? How are the social determinants of health actually impacting this? And, back to our discussion just a few minutes ago about students asking really tough questions. 3 years ago, one of my students who's in my medical education and leadership scholarly concentration track came to my workshop vehemently angry and near tears because she was so upset that the lecture that had been given in their practice of medicine course was talking about the sickle cell patient who's always Black, the HIV patient who's always gay,
Oh, yes.
The
talk to
the
him.
drug addict who's always Black. And she's like, why are they teaching it this way? And to my blind eyes at that moment, I was like, look, I understand you're really passionate about this, and I don't want to, dissuade your passion. I followed that though with, this is how we learned it. So I don't think there's any malintent. Like, I truly don't think there's any malintent behind the way this teacher is presenting this information. It's simply that we don't have the foundation to teach it any other way. So like the whole unlearning process and the whole decolonization of our medical curriculum, it's going to take years. Right.
I love that you say that, because it's so ingrained in our medical teaching, right? That you just, like, even medical students know, like, certain buzzwords equals certain diagnosis. Like, if I say, a Black woman who happens to have hypercalcemia, they automatically start thinking about sarcoidosis. I have no clue why but it's just one of those things that they just boom, 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 like, boom, and then they kind of match along. So I 100% agree. Like, we have to have foundational changes so so that Black patient doesn't always happen to have sickle cell, right? So that homosexual patient doesn't always happen to have HIV, which is crazy when the numbers, like, don't make.
Well, and in DC, that's like a heterosexual woman is more likely to have HIV than a gay man.
Right, like, that's the numbers don't make no sense for that to even still, but yeah.
But the steps are still written that way.
Mm-hmm. And it's difficult because you tell them to try to learn it. But, to be successful, again, you're going to run into, unfortunately, standardized test questions, right, that are going to play upon a bias and, a non-inclusive approach of how they train us. So I definitely agree that it really does take a very active approach to have to unlearn so you can then turn around and teach. I love that. Very, very interesting especially from a perspective.
But to your point about the kneel-in, very shortly after George Floyd's death, Dean Haywood got together with our medical school dean, who is our first female dean, and they put together a statement out to the whole GW community about our dedication to anti-racism, and arranged an entire school-wide kneel-in. And I had my son that day, so I couldn't go to campus, but I did it on my front lawn, with a camera, and I was there for, 8 minutes and 26 seconds. I can't remember.
46. And when you do that kneeling, like because we 8 minutes sounds kind of long. And when you're kneeling, you realize, like, wow. Right. And I think just that symbolism really makes that gesture even more profound, because you get to minute 2 and you're like, oh, okay, all right. And then you get to minute 4 and you're like, whoa. And then you get to minute 6 and you're like, okay, like you start twisting and try to stretch your back. And then minute 7, and it just seems like it's going forever. And then you think in the back of your mind, like, wow, like, this person had someone's knee on their neck for this long. And I think that's what really drives home the symbolism behind it. And I love that GW was like, no, we're going to just get behind this. Like, this is what we're going to do. Why do you feel that was important, right? Especially in this day and age, especially with medical education being the way it is, that not only do we have to promote just the aspect of, being anti-racist, right? Which is sounds crazy, but I think, like you said, like, it was around you, but until you actively had to do something, you started to realize, like, oh, I actually have to be active in my approach, but also inclusive as well. which is something I think, especially in medicine. I know, again, like I said, because like I said, I got plenty of family in military, plenty of family in the law enforcement, and yes, I know you hate the way I talk about police, but I know I'm talking from a glass house as well. I know medicine has its issues that it needs to address. Why do you think that level of importance, especially as your institution is kind of standing behind you to say, like, not only do we have to be anti-racist, right, but we have to be inclusive as well? Like, why do you think especially those two factions were very important?
So I think my role, at least in it, is because there are implicit biases across the board, there is a very high likelihood that someone who looks like me is more likely to listen to me than they are to listen to someone who is a person of color. And so I know that based on our own implicit biases, that I may be able to have a conversation which breaks down those walls a little bit, or at least fosters a thought-provoking conversation. Because I think that, like, there's never going to be a switch for the folks who do not currently see it as a problem, who do not currently recognize systemic racism and institutionalized racism. There's not going to be a switch that flips them, but there might be certain things that, okay, let's look at this policy. Let's look at this policy and figure out ways in which this policy might potentially lead to a lack of diversity. Let's look at our hiring policies. Let's look and see how truly inclusive we are. We have inclusivity and diversity listed on our website, but let's actually look at the landscape of the people that are in our institution, and let's say, have we put our money where our mouth is? And if we are asking people to do things to build up the reputation of our institution, are we paying for their time? Are we valuing their time? And are there opportunities that are being given to a certain group that are not being equally provided to another group? And what are we doing for those of us who are in positions of leadership? What are we doing to further lift other people up to our level and promote them even beyond us? That's where the inclusion story comes in. And I'm still learning about organizational structure and organizational design, and I don't know anything about writing policy. I'm not a policy expert, but I have friends who are, and I think that that's the other thing is there's not one person's going to solve this problem. This has to be an interdisciplinary, cross-cultural change. You're going to have to involve everybody at every level. The people that are at the front door checking IDs, and the people that are answering the phones for you, and the people that are cleaning your bathrooms for you. Like everybody has to be part of this conversation, and everybody, I mean, you just have to demonstrate that you value people regardless of what they look like or where they come from. You have to value each person and where they came from. And
what I love, especially obviously the position that we're in, being in graduate medical education, because this is something I grapple with really constantly. Just that onus of really having to actively think about it. Like our program, we have 18 medical residents total, so 6 every year. And when I look across the landscape of people who are applying to the program, and where they're coming from, and you see kind of the same similar approaches, and you see, like, all right, the same type of people are applying, and what am I doing to reach out to a population that I would like, right? Like this year, right, like I was kind of ecstatic. This year we actually matched 6 women, right? All 6 spots, all 6 women, which was like a secret goal of mine. Because when I came in, the ratio was 12-6, or no, I think it was like 13-5, and I was like, how is a woman gonna feel like this is a part of their residency as well if they can't look out and see a lot more people that look like them, right? And that that standpoint. So it was definitely a very, but I think you're right. It does have to be a very active approach. Like I would post in women's groups, and I would say, hey guys, think about this program. Like and especially because I already know I'm kind of behind the 8 ball, because all of our faculty, right, happen to be men, right? Like I'm just looking around and I'm seeing things that, like, if I was a woman, right, like would this be the environment that I would want to be in? And if it's not, what can I do, right, to help it be that way? So in your stance, especially in graduate medical education, where you're dealing with medical students and residents, and like how is that approach? How do you try to take some of those practices into that approach, and just kind of what you're doing on a day-to-day basis?
Mm-hmm. So I think it's probably most pertinent for residency recruitment, because I don't do interviews for med school recruitment for med school admissions, but I do interviews for our residency recruitment. And I think for us in particular, we probably need to take a critical look at how we review the applications ahead of time, because when you have a certain number of applications that come in, a lot of times we create these strata. So, okay, you had this board score and you had this grades, then you go in this pile. If you didn't get this board score and this grade, then you go in this pile. But what has become more clear to me recently is that just because you didn't get a board score a certain way does not necessarily mean that you are not a competitive applicant. And I know I took the MCAT twice, and I paid for a Kaplan course because I was working full-time as a nurse and I could afford it. But not everybody has that opportunity. And there are, in many cases, life experiences which are much more informative and much more valuable to your life as a physician than the performance you had on a standardized examination.
Ooh, we talked. Oh, lunch learning community, you can't see me, but I've been shaking my head probably for like the past 5 minutes, because I'm like, oh yes, oh yes, oh yes.
So I think there needs to be again, it's a cultural thing. So you have to look at everybody who's involved in residency recruitment and, spread the love. The reviewing applications shouldn't just be one or two people's job. You can spread the love a little bit, but we should be taking a critical look at other things that are adding value to EQ. Where's the EQ score on an application? Oh, there isn't one? Well, because we don't have a good way to measure it. But this is the kind of thing that, when you were 13, you got a job, at the corner deli because you had to help pay the bills for your house so that your family could survive. And then while you were in school, you were also waitressing. And then while you were, doing this, you were also candy striping, but you don't have any research. Well, you don't have any research because your family was trying to survive. And you have a better, and again, this supports the research out there that demonstrates that folks who come from lower socioeconomic background are much more in tune to their patients' needs in primary care, who are also in those environments. What does someone who, not to disparage anyone with an Ivy League education, but what does someone who is an 8th generation Ivy League educator know about living in poverty? They may be the most empathic person. They may be a phenomenal physician with tremendous amount of knowledge, and they may have all the feels and really be able to connect with their patients. There are some things you cannot connect on if you have not lived that experience.
I love it. And it's so true, because that just having that connection there, and having that will to go outside of the quote unquote norm, aka the board scores, aka the fancy letter of rec, aka even the fancy medical school. being able to go outside that and really look at, your future physician as a whole, not only makes, you, I think personally a better person, but it really will make your program a better program, right? Just to have that kind of diversity across the board and level of experience in life, level of experience and knowledge, just because it's there, right? Because once you're an intern, I don't care where you went to for medical school, you don't know much, right? I don't care what your board scores was. The second intern day, one touched around, you realize like, oh, like I'm in for it. And I always say that first week of intern, let's say I'll even give them the first one. That first month of internship is always a very humbling experience for many, who come through, because they realize like, oh, like, okay, this is the real work is really starting. Like what I was doing was preparing me to get here, but now I got to get to it. So I 100% agree. Just the fundamental aspect of, how we select, who we select. And I do agree. We're definitely missing the life experience associated, with our future physicians, because all we're doing is looking at these numbers that are skewed in so many ways. Some people are better test takers. Some people can afford the multiple review courses before they get to actually take the tests. And some many people don't have to deal with the anxiety of, if I miss this one or two questions, right? Does my family not eat, right? That's those are real life situations that medical students, pre-medical students have to face, right? Even residents when they're getting out, like they have to face, like, if I don't do well on this test, my whole career trajectory changes in their mind, right? Usually, but like in their mind, they think, if I don't answer this one question correctly, like all of a sudden I don't become blank. So I definitely agree, like having to really take a 360 look at really from the top down, and seeing what we're doing and seeing what we can change is really paramount to kind of get into where we need to get to.
I mean, it's not as much, it was not for me as much for my medical school application, but for college, like I had that scenario where I was in high school, and because of things going on at home, I bombed my first ACT, and I was not going to be able to get into college. And I remember going to my parents in tears, knowing what it was to ask them for another $200 to pay for that test. And this was in 1993. $200 was a lot of money back then. And I mean, for some families, even today, $200 is a lot of money. And the pain in my heart when I had to go ask my family for that and just deal with the ramifications of needing to do that, like those are the kind of things that our students who are coming from, lower socioeconomic backgrounds and underrepresented minorities, that's what they're seeing. That's what they're feeling.
I love it. First of all, I just want to thank you for, such an amazing conversation. And it kind of really just definitely needs to be had on all fronts. And, thank you for making a leap and becoming, an author, right? And allowing us to go and open your world up, right? Because I know that's a very tough thing to do, right? Kind of open up to really strangers, right? So we definitely appreciate that aspect and your will of it. If I had to take one thing away as a reader, when I read your chapter, if I had to take one thing away from it, what do you think that would be? Like, what would be your one thing, for like one goal that you'd want the reader to take away from and be able to carry and go to the next level wherever they need to do?
I think that the one thing that I would want people to take away is that your life experiences don't define you. And good, bad, or ugly, those things don't define you. And you should not be ashamed of the path that you had to take to get where you are, because you're strong and you're beautiful and you can do whatever you want.
I love it. So, Dr. Ogle, before I let you go, I know I said it before I let you go, what's next for you, right? So obviously, you're an accomplished author now, clearly have an amazing cemented role in just graduate medical education, but what's next for you? Like, and it's so funny, like, I love that you talked about, having to, be with your child since March. My wife, she's with our 3 kids who've been here as well too. And I definitely sympathize because I can imagine just that transition while still having to do everything that you're just kind of doing on an amazing front. So first of all, thank you for doing that. Right. Like that's, shout out to you. If you haven't gotten any kudos for that, because that is not an easy transition. But what's next? Like, what do we have planned? Like, what can we look for? Like, again, because I'm excited, and like I said, I'm, just being, fellow academician. Is that am I pronouncing it right? Because so just being a fellow academician, like I definitely want to make sure I'm gonna like connect with you to make sure I'm doing well, and if anything I can do or you can do to help us out, definitely reach out. What you got planned?
So I think the next big thing on my goal list is I'm going up for promotion in December. So I hope to go from an assistant professor to an associate professor. And last September, I had the opportunity to speak at a national meeting. Feminem is an organization of women in emergency medicine. And really, it's become a cross-specialty phenomenon, talking about gender equity and the like. But that experience, and again, it was me, similar to the book, it was sharing a very personal story of, my upbringing. That experience was transformative for me. So what I would really love to do is I would love to get on a speaking circuit and be able to share my stories in different ways. Because there's layers to this onion. I have a lot of layers. The 2 chapters that are in the book, that's only scratching the surface.
Small as well.
Yeah, there's lots, from and again, my son's father and I have a beautiful co-parenting relationship now. It has taken years to develop that. And there's stories behind that as well, and even, stories about what happened in medical school, and I would just want to talk to people, and I want to hear their stories too.
And I just from listening to you, talking to you for this past hour, I think you would be amazing, right? Because you seem so very calm, so very collected. And Lunch Learning Community, I don't know if you guys realize that, like a lot of times, I don't prep the guests, right? Like, so they just turn on and I just start firing questions. And it is, I just love like how calm and poised you are. So I could easily see you on the stage killing it. And of course, unfortunately, especially you being in an emergency medicine, me being a hospital physician with the coronavirus and everything kind of, stopping conferences internationally. When they do open back up, I'm in Florida, so I'm pretty sure you can see the news. We're not doing very good as far as wearing masks. But I do hope, and I do definitely send wishes and prayers for you on that stage, because I could definitely see you with a story that could definitely motivate. And that's really the thing about speaking. Is there's so many in the crowd that we don't even realize that we don't even, like when I do the podcast thing, like I talk, and I'm always shocked when someone says, "Oh, hey, I listened to your podcast last week." I'm like, "Oh, you listen to my podcast?" Like it's just one of those things where like it just hits you. And when you have a story, like yours, like I know that's gonna resonate with someone who's then gonna take the baton, right, and who's then gonna get up, right, after they fall and realize, like, no, if Dr. Ogle, right, is able to kind of get through what she was able to get through, I need to be able to keep on going. So definitely we will, especially from Lunch Learning Community, we're definitely going to send, wishes and prayers to make sure we get you on that stage whenever the coronavirus allows us to get you on that stage for that point. Now, where can people pick up the book? Where can people, if they want to follow you, especially if they're not in the DC area, like where?
Of course. So you can get the book at the Chronicles of Women in White Coats.com. And we are a self-published group. So the 10 authors got together and, put in a bit of a personal investment from each of us in order to be able to publish this book. And so when you go to the website, you can choose the author that you would like to support. And I think you're interviewing some of our other co-authors.
I'm interviewing a couple of them. I interviewed Dr. Robbins, Amber Robbins. I forget her episode number. It was like around the low hundreds. And I interviewed Dr. Kim, probably like in the 140s. I just remember them in like groups now. Like it's, that's how we have to do it. And I think I already interviewed Dr. Maxwell, and I think I got like 2 more. So I'm definitely excited. And I didn't say this on Dr. Maxwell's interview, but I am actually going to be supporting the Women's White Coat. I'm going to be giving 10 books away, right, to our lovely listeners, right, who need to be enlightened, need to read these stories, need to be able to be, get some of that personal touch. Because like I said, I understand. The as a man, right? Like I may not be able, I could say stuff all day, right? But if you're a woman, maybe you're not necessarily going to hear it like I want you to hear it. So I want to make sure you get access to these amazing women, who have an amazing story to tell. And any physician who has a story to tell, right, and who isn't scared to tell it, right? Because again, I've said this before, Lunch and Learn community. You know me. I think one of our this services we do in medicine as physicians is we keep our story to ourselves, and we don't allow the pre-med who's going through that similar trial, right, to see like, oh, there's that example I needed to keep going, right? There's that, like, so like I love physicians who are able to put their heart on their sleeve and say like, hey world, here I am, right? Like hear me roar. I'm ready. I'm ready to take whatever you're going to give me, because I know I'm going to touch somebody else. So I didn't say it on Dr. Maxwell's interview, but like definitely make sure we are going to be supporting these ladies and these women to make sure like we get their story out to where it needs to get to.
Awesome. As far as where people can get a hold of me on social media, you guys can follow me on Twitter. I am Dr. Kitty Cat, both with a K. Kitty with a K and cat with a K. Dr. Kitty Cat. I made that handle like 10 years ago.
Yes. Lunch and Learn community. Remember, the links will be in the show notes. So you don't have to like write it out anywhere, especially if you're driving or something. I will put the links in the show notes. Go directly to her Twitter, follow. I'm gonna like right when I'm doing this interview, I'm gonna follow her Twitter as well too. So, so Dr. Ogle, thank you again for such an amazing word, such an amazing story. Helping us really get enlightened with everything that's kind of going on, and we wish you nothing but success with the book, with the speaking, with everything that you got going. I did the active edition, the GME stuff, like all of it. I wish you success in all of that.
Thank you so much, Dr. Berry. And you stay safe down there in Florida with the coronavirus. Thank you so much for having me.
Thank you for coming to the end of the episode. It is yours truly, Dr. Berry Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there because your support is so valuable for what we're doing here on the Lynch Learn and everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222, and you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out, because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thank you guys. You have a blessed day, and I'm going to see you guys next week.